Pop-up GP is a personalised general practice service offering patients an appointment-based choice of consultation times with a general practitioner, either by video or face-to-face at your home, work or in clinic. We're lucky to have founder Dr Deepak Gaur with us today to tell us a little more about his new initiative. Thank you so much for joining us today. I'm really happy to be speaking to you. I know doctors are really busy people, so thank you. And I'm really interested in your new initiative, Pop-Up GP. Can you tell us where the idea came from?
So I had just come back from the United States and I had a career in the pharmaceutical sector, and I was thinking about my next opportunity. And so I came up with this idea of a personalised general practice where we would provide services to patients, provide home visits, provide office visits, provide visits to their aged care facility, and provide conventional in-clinic visits. And with what's happened in the last year, the other option came up of adding video visits. So, the technology to do consultations with patients by phone or by video is not new. It's something that's been used in remote Australia for some time, in far north Queensland, in the Kimberleys in Western Australia. It's a very common feature of medical care because it's not appropriate that a patient has to travel 5 hours for a routine visit with, say, a specialist. So, telephony and some sort of video service has been used for many, many years, but it's not a service that we've really been able to use in the cities. And so with what's happened in the last year, this concept of telephone medicine or telehealth or video calls has come about. And so when I came up with this concept, I added the concept of video visits to this. So it's video visits, home visits, office visits, aged care visits, and clinic visits. And it's really about giving a patient a different option to say, for your routine medical care, we can provide you with a personalised general practice whereby we'll come to a place at a time of your choosing. We can come to your home, we can come to your office, we can come to your aged care facility as a routine part of your medical care, not just when you're very, very sick and say you're unable to get into a car or a taxi or an Uber and you actually come to a medical clinic. So I think that's quite different. I think the opportunity to come to a patient's office is different. Clearly, it has to be an appropriate setting. If you have an area which is private, such as a sick bay in a large business, that's fine. You can't do it in an area where it's activity-based working or open plan. That's obviously not appropriate. But it needs to be somewhere where you can conduct an appropriate medical consultation with an appropriate examination and particularly privacy for a patient where you can perform the examination and have that discussion. So, I think that's again a different type of offering. It's not typical that a patient would see their medical practitioner, in their office. But I think with what's happened in the last, year particularly, we're seeing telehealth happen where a patient may go into a meeting room. They may be on a call with their doctor. None of their colleagues know whether they're doing, having any other sort of conversation. So you can have that privacy. But I think actually going to the office and providing that service is, again, a different opportunity.
I've never heard of that a doctor will actually come and see you at your work. That's fantastic. Great.
The concept of people working 9 to 5, Monday to Friday, getting home to watch the 6 o'clock news, that's all different now, isn't it? I mean, people work different hours. People have much more dynamic nexus between their professional responsibilities and their personal responsibilities. Friday and Monday are no longer the busiest days at work necessarily. You see that with traffic being quite light. And plenty of people are working different types of shifts. You see that in hospitality, you see the people in the travel sector. So I think you've got to think about, how do we provide the best patient service possible? And how do we do that at a time when people actually are able to get to the doctor? I mean, typically, when I go and see my doctor, it's after work. And it's after a long day, and you sort of get to your general practitioner, leave after work. Then you have to follow up anything you need to do. After that, such as go to a pharmacy or think about an appointment with a specialist or a radiology firm or a pathology firm. So there are all these processes involved, and I think what's happened in the last year has really offered patients a different opportunity in terms of trying to see doctors via a different means. And it was actually before that time that I thought about this type of this type of personalised general practice. But certainly my thinking was influenced by what's subsequently happened. My thinking's certainly been influenced by what's happened, in the cities in terms of where the practice should be located.
What do you see as the main benefits for patients with this system?
Your time is precious. It's one of these commodities that you can't alter. And I think in between your professional responsibilities, your personal responsibilities, it's quite challenging to sort of manage the activities of life. So if we can come to a patient's home or their office or their aged care facility in a pretty broad range of hours, we're actually providing that time back to a patient rather than them spending it travelling to a general practice, waiting to see their general practitioner, and then travelling back home from their general practice. So I think it'll particularly resonate with patients for whom time is of the essence and whom time's very limited, and they value their time to say, well, okay, I would actually like to utilise this service. And so, if you can say to a patient, if a patient says to me, look, I'd like you to come and see me once a month for my blood pressure check or my heart failure check, could you come and see me at 7 a.m? Well, we can think about that, and perhaps we can probably make it work. And so I think that's providing patients with a different level of service. I'm a doctor, but I'm also a patient. And so, when I utilise medical services, it's generally after work. But if I could utilise a health service, for example, but before I got to work, that would again be very attractive to me.
Can you or do you bulk bill home or office visits?
So we're not going to be bulk billing any appointments. I think bulk billing's a really, really important part of the healthcare system. But largely, when you think about it, even the term bulk billing tends to refer to relatively, certainly fixed fees that are reviewed by the government generally twice a year. And I think if you look at the bulk billing fees, the fees you wouldn't say the fees have necessarily gone up significantly over time. And I think that's why you often see, if you work in a practice, there's a difference in terms of the number of patients you may see, difference in appointment times. I'm offering 20-minute, 40-minute and 60-minute appointments in my practice. And I'm building capacity around those appointments so that we're trying to space those times out. We're trying to allow for a consultation which may take longer than expected. The model is certainly an appointment-based general practice. And also it's a system which allows a patient to book an appointment online 24 hours a day for those appointment times, cancel appointment online 24 hours a day for those appointment times, but also they're paying the fee for the appointment when they book it. And if they need to change the appointment, they can just cancel it, and there's no problem with that. Again, I think it's about that that giving that responsiveness or that opportunity for the patient to say, okay, I want to see a doctor at this time and this date, or if something comes up, I can cancel, and there's no consequences of that. So I think that's from my perspective. I think that's the most sustainable approach to this type of service.
It genuinely sounds like a really good service. How affordable will it be for patients though? Like if you're an office worker and you'd really like to take this up, do you think it'll be affordable with the gap?
I think it's going to be for patients who really value their time and do think this service offers value. I'm starting video visits for 20 minutes at $75. I'm starting in-clinic visits for 20 minutes at $129. And I'm starting home visits, office visits, and aged care visits at $199. So that is to allow time for a general practitioner to get to see you, to spend an appropriate amount of time, assessing a medical issue, and then also to have time built in to allow you to get to the next patient. And one of the goals is actually to be on time. So I think, people will value this. People will value the service and say, okay, this time is of value to me. And also I think that they may take a different approach to how they perhaps systemize their lives. So there are people with chronic disease, for example, who need to see a doctor regularly. Someone with diabetes, for example, is seeing a doctor several times a year for regular blood tests, for example, to manage their diabetes. And it may be, and one of the goals I have is actually to really make that efficient for the patient. So, for example, we know there are certain certain processes and procedures you need to have on a regular basis. So, for example, a flu vaccination for someone with a chronic disease is very important. I think, we should schedule it so it's efficient for the patient and say, okay, you're due for your diabetes check on this time. The flu vaccination will be coming at the same time. Let's make sure we do everything in one go. Let's make sure we give you your referral for your next set of blood tests and urine tests at that time. Let's make sure all your prescriptions are up to date. The goal is to be able to provide that very personalised practice, that personalised general practice service, and really coordinate the patient's care. And I think that's one of the great challenges in general practice, is to really coordinate a patient's overall care. And I should be able to say to a patient, look, your repeats are running low. You need your next repeat of, say, the oral contraceptive pill in 3 months, rather than waiting, or say, let's give you that now so it's efficient for you. So again, you're getting some value out of that time for the other issue, and we're managing your overall health. I mean, many things in health we can plan. I mean, I can look at a patient's file and say they're about to get to their last repeat of their chronic disease medication. I can look at a patient's file and say, for say someone with high blood pressure, we haven't done a blood pressure check for this period of time. And then while we're at it, we haven't done a fasting cholesterol, for example. So, one of my goals is to try and systemize this medical practice and systemize the service so a patient gets the maximum value. So when you see a patient, you're actually taking an active interest in their care, thinking about their chronic disease care, and making sure we're giving the appropriate reminders in place. For a female patient, we should be able to tell you, look, your PAC test is going to be due on this date. For a person who's got children, we should be able to say, your children's vaccines are due on this date. Let's try and organise it so we get everything done at the same time, rather than we see you and then a week later we say, you're due to have your this vaccination for your child. We should be able to say to a first-time parent, you're having your first child. For most first-time parents, we give you a pertussis shot, and so a pertussis vaccine we then give to everyone near and dear to you who's going to come and see the baby. So let's try and organise this. We can try and be organised and strategic in healthcare. It does take time and planning, but I think that's what a personalised service is, and that's one of the goals I really have in this practice.
You could probably get to know your patients on a different level, seeing them in their home or their workplace, I imagine. Like get a fuller picture of your patient.
The doctor-patient relationship is very important. It's a mixture of respect and rapport. And you've got to be at a point where you're able to have an honest conversation with your doctor and express your concerns about it, some symptoms you may have. Talk to them about how you're going with a particular, medical condition you have. If something changes in your life, be able to bring that up with your general practitioner. So it's really, really important. So I think that building that relationship is important. I think, with video, I think video is superior to telephone. You're looking at someone in the eye. At least it's not the same as being in a room with someone, but you can develop that relationship. I don't think there's any substitute for a face-to-face visit, but I think sometimes we understand it's practical for a patient if they might be interstate, for example. They might be interstate at work. They might be having a holiday, and I think so there's a rationale for being able to do a medical consultation in that circumstance. I still think it's better face to face, but I think sometimes it's practical to be able to do things by that means where it just may be a very efficient use of time. We know globally that many patients deferred going to a doctor for their chronic disease issues, so diseases they already had, illnesses they already had, where they may be already taking medications for a condition. And we know that patients deferred going to a doctor for new problems. And unfortunately, there's going to be a consequence from these circumstances. And, unfortunately, you're going to have patients who may have a late diagnosis of a new problem, may have deterioration in a chronic disease. And so I think, we have to take this very seriously. And we're certainly seeing that, outpatient clinics and specialists, are very, very busy because they're catching up with work at a period of time where, outpatient clinics were closed. New patients were not being seen, and critical surgery and other procedures were being deferred. So, we're going to have to deal with this, and, we're going to have to deal with this for some time, because obviously there's a number of issues in the community at the moment, and we are still living this experience. And we may have, additional times when perhaps our movement may be restricted if there's, you know, new outbreaks.
Yeah.
So I think it's been an experience that, you know, we haven't seen in the past. And I think we have to try and, you know, really prioritise a patient's health to try and give them the best outcomes.
I really love the idea of pop-up GP because it sort of harks right back to the beginning, doesn't it, where the doctor with a doctor's bag would go and visit patients in their homes. And what sort of equipment will you be carrying with you if you go and see someone, say, at their workplace? Like what sort of tests would you be able to do on the spot there?
I would carry the typical equipment we use to do an examination. So, you know, a blood pressure cuff you'd always carry with you. You'd always have your stethoscope with you. You'd always have both an otoscope, which is something, an instrument you use to look in the ear. You'd have an ophthalmoscope to look in the eyes. You'd have this sort of the paraphernalia we've all had, you know, experienced as patients, you know, a tongue depressor to look in someone's mouth. So I think there's sort of the routine tools of trade that we use as doctors that many of which have been established more than a century ago. Some of them probably closer to 2 centuries ago. Yeah. So that sort of equipment you'll always have. I think in terms of actual procedures, it's a question of what is appropriate to do in a consulting room. It's still best to be able to do for example, a surgical procedure like a biopsy or a removal of a skin lesion, you know, in your room. So I've got my clinic set up, and I've got, you know, the right lighting, the right sterile containers, the right, you know, surgical equipment, the right equipment to dispose of the sharps, all that sort of stuff's in our clinic. And I think you'd ideally do those type of procedures, you know, in the clinic while still being able to assess a patient. And, you know, particularly if someone is acutely unwell or they've come in with a symptom where, you know, a symptom can be caused by many, many conditions. So I would expect to be able to, you know, do a typical examination you do, you know, in a clinic room, also in someone's home, office or aged care facility.
I have actually been in general practitioners' offices, and I've actually heard people go up to the receptionist and say things like, I've taken half a day off work to come here, and the doctor's running like 3 hours late, and they actually have to take time off work to actually go and see their doctor. So I can see, like, if you go and visit someone at their workplace, you can probably do so much, like skin checks. You could probably pick up melanomas, that sort of thing, where it may have been missed if someone's put off going to see their GP because of the time, like you said.
You know, Queensland has the highest rate of melanoma in the world. And we know, you know, the Slip, Slop, Slap campaign, which started many decades ago, and which, you know, some of us remember as children, is now, you know, regarded as one of the very, very important public health campaigns that's happening anywhere. Yeah. So, I mean, that's a very good example. I mean, you know, doing a skin check on a regular basis, similarly, you know, being able to look at a new skin lesion that a patient's worried about, or an existing lesion that's changed that the patient's worried about. This is all very, very important. And again, being able to, you know, document this evidence, then say, you know, we last did a skin check on you at this time, I think it's due again. Being able to systemize that with other things that are happening, such as a repeat prescription, a repeat, you know, pathology referral, etc., a repeat vaccine. I mean, all these things can be coordinated so that, you know, we do things at a regular basis. I mean, we don't think twice when we're driving in our cars and we get this automated message saying, you know, your service is due in, you know, 500 kilometres, you must do this. We react straight away and say, I must book this service. But I think we've got to prioritise our own health. And I think as a general practitioner, you know, we can work with a patient and coordinate things to plan things out. And, you know, many, many things we should be able to plan, you know, in general.
What do you see for the future of pop-up GP? How do you see this initiative growing? And do you think other general practitioners will take it up, or medical practitioners?
We're certainly seeing with what's happening in the last year, certainly there is a number of general practitioners are offering telehealth or video health service. So that's in place now. I think many general practitioners do house calls as part of their routine work. I'm not aware of any general practitioner as part of their routine that they would routinely do a house call for a person who's not, say, in an aged care facility. So I think in terms of someone who's very, very ill, yes, that's very common. But I think in terms of someone's routine care, like their repeat prescriptions, for example, I don't think that's so common. And it's really a question of, you know, how comfortable a practitioner is with this type of model of care. It's obviously different being in your practice, the typical practice we've all been in, where you enter the practice, you've got a large waiting room and you're seeing your patients and essentially, in your clinic. I think it's going to be highly variable in terms of what patients think, what general practitioners think. And clearly there are after-hours medical services where a patient will come to see you, and generally it's for an acute issue. It can be for regular scripts, etc., which a patient may require. But I think it's really going to be very dependent on that doctor-patient interaction and what people think of this type of setup. I think, medicine is an ancient profession, and there's many, many ways to manage patient care. Yeah. I think, what's happened in the last year has changed the interaction between doctor and patient. And I think patients will say, well, I want a higher level of service. And I think, it'd be very interesting to know, does what's happened in the last year increase our priority on health? Does it increase our desire to be healthy, to understand our health conditions? I think, the average person probably didn't know what the word comorbidity was a year ago, but now they've heard about it because of, again, the environment. And so I think patients, I would hope that we'll have a better understanding of health and a better ability to prioritise our health. There are some issues in the community, though, which are really problematic. We've seen a very significant decrease in smoking rates over the last few decades, but we're seeing an increase in obesity. In terms of obesity has huge consequences for cardiovascular disease and diabetes, and they are major risk factors where the risk is, additive. Yeah. And so I think, obesity is one of our great public health challenges. Yeah. And we've not seen significant improvement in many countries. And in fact, there are countries where obesity was not a public health concern, say 1 or 2 decades ago, where it has changed. Mm-hmm. And so, this is going to be, a catastrophic issue that, in terms of having obesity plus aging, is going to increase the demands on the health system. So the number of patients with cardiovascular disease and diabetes, if things stay the same, is just going to keep soaring. Yeah. And so, that's a really, really important issue that we need to tackle, and probably in some very innovative ways. I think, to your point, it will require people to work together. It will require really, really important dialogue with the community. We need to provide patients with information. Health is often a misunderstood issue. I often use the analogy with patients that, the challenge for health is that there's so much noise. Every day there's a new article about a new fitness tool or a new diet or a new option of healthcare. And it's very difficult for a patient to be able to differentiate, say, what's of value, what's the level of evidence, what's going to be beneficial for me. I often say to patients, it's a bit like if you managed your own superannuation, you listened to all the noise in the financial world and you made all the decisions, you probably wouldn't be as good as having an expert who's managing, your professional affairs. Yeah. So I think it's very challenging to be able to reconcile this. And I think, spending time with a patient discussing their issues, understanding the important medical issues to screen, their potential risk, family history, their environmental circumstances, their mental health. We've probably talked more about mental health, in the last, year than we have in the past. And it's very, very important. There's a, real intersection between mental health and other disease. Mm-hmm. Sometimes cardiovascular disease after an event is associated with a mental health issue. But there's a clear link between mental health and other medical conditions. Mm-hmm. And so, looking after patients is very, very important. Listening to patients is very, very important, and trying to provide a personalised service, is very, very important for the individual to try and give them the best health outcomes.
I think Pop-Up GP is a fantastic initiative. I think we're going to see patient care move to a whole new level with this, really, and it's going to make patients, I think, feel very valued and looked after and safe. And congratulations on coming up with it too. And thank you for your time.
Thanks, Debbie.
See you later. Bye. Bye.